I think everyone agrees with Dr. Benjamin. We need a strong CDC. And as we transition out of the public health emergency, we've just got to make sure that our public health partnerships across the country have the tools necessary to protect our neighbors and ensure they're healthy and well. And I think I see a common thread in what a lot of you are saying. We need to have the most accurate, thorough, and timely data to inform the guidance. We need to be able to detect disease in real time, stamping out problems before they grow. I know the GAO, one of your top recommendations, data are critical to inform the response to a public health emergency. However, the data HHS relied on during COVID-19 were incomplete and inconsistent, highlighting long-standing concerns there. Public health data are collected by thousands of disparate health departments, healthcare providers, and laboratories, as well as multiple agencies. But, Dr. Benjamin, as you state in your testimony, you watched in horror as the rural communities, hospitals, skilled nursing centers tried to send data via fax machine. It is completely outdated. So the Congress responded, and we provided some emergency authorities to CDC and some funds to modernize. But now as the public health emergency expires, those emergency authorities expire. That's why I have reintroduced the Improving Data in Public Health Act with Congresswoman Lauren Underwood to promote data sharing and modernization to better identify, monitor, and respond to public health emergencies. So how would, Dr. Benjamin, talk to us about the outdated nature of data gathering across the country and how a more modern system would improve the result?
Yeah, you know, thank you very much. The truth of the matter is that when I was a deputy health officer in Maryland in the mid-90s, we were sending information by fax machine, and we're still doing it. And the problem with that is that the person that fills it out by pen and ink. They put it in a machine. It goes off to another place, and then you suddenly realize the data set isn't complete. Now you got to go back and track and find the person who filled out the data. And we have just far too much of that. And, you know, look, Congress did invest after 9/11 and the anthrax letters funding for public health. The problem was obsolescence kicked in. We didn't keep the funding up. We were just talking a little earlier that, you know, college today used to be a one computer experience. Now it's a 2 or 3 computer experience for your kids, just because the technology changes so quickly. And we've not done that. We've not built a data information technology highway. We don't have a single patient identifier. We don't know that Dr. George Benjamin in one system is the same George Benjamin in another data system. I know there are concerns about patient privacy and the data being misused, but the bank gets your data. Other systems get your data. The proof of concept we had during COVID was that it worked. And I think you've heard from all of us that the importance of how important that data is.
So you can de-identify personal identification of people, but it's important to collect all sorts of information on age and health disparities, isn't that right?
Yeah, most of the time, and we can divide it up in many ways, but most of the time, what CDC needs is to know whether it's going up, down, and whether or not the numbers are not duplicative. And so there are systems that can do that, and the box can make that happen for you. We have the data systems already to do it. This is not new technology.
And it's not standardized.
It's not even standardized.
That's a very significant problem. Talk about that a little bit.
Yeah, the fact that just the data that comes from one hospital to another hospital, from a health department, you may not be all sitting in the same data set. Those of you who have looked at your lab tests, when you've gone to the doctor, you'll know that sometimes they're not the same. They don't get reported in the same way, and that's a problem. Particularly when you use electronic systems, which use zeros and ones, the system will misinterpret what it's getting.
So where would you rank improving data reporting and giving CDC the authority to standardize things across the country in our toolbox as we move to improve the CDC?
I think as a tool, it's number one. I think from a functional perspective, I have another issue, but in terms of data is top of my list.
Thank you very much. I yield back.
Gentlelady yields back.